Good morning. I want to welcome you this morning to our challenge of long-term care here in Northfield. And my name is Clark Carey. Up until a year ago, I was the chaplain at Three Links. That's on. Sorry about that. Up until a year ago, I was the chaplain at Three Links Care Facility and have since retired from that, but I'm still very concerned about long-term care. What prompted us to move toward this particular program was when we read or heard that the long-term care facility at Northfield Hospital had closed. And so at our Mission and Justice meeting, we decided it's important for us to pick up on this, and along with Jane Rensheimer, and also Gary Meisler, who is gone today. We did some planning through the Mission and Justice Committee, and we have invited some people to be with us. Jane will introduce them in just a moment. I just want to say that if you have questions, we ask that you hold them. We want to try to get through as much of the material that we've encouraged them to prepare for. And if we don't get the question, there are little yellow sheets in the back. Write out your questions. Karen, you to hold that up. Thank you. And give them to us when we leave, and they will help influence what we do in the future, because we do believe this is a huge topic. I'm not able to cover it all in one session. And we'll also think about a different venue, so we don't have a lot of time restrictions. We have about 45 minutes or a little less before we get ready for worship. But thank you very much for coming, and I want to call on Jane at this time.
Okay, sounds good. Can everybody hear me? Okay, great. So my name is Jane Rensheimer. I'm a family physician at Alina Clinic, and I was the medical director at the long-term care facility at the Northfield Hospital for over 10 years. And so, like Clark said, we're excited to kind of hear from our leaders in elder care in our community today, and kind of find out what's happening and also what we can expect going forward. So I'm going to introduce the panel, and then there's handouts in the back with the 4 questions we're going to be talking about today. And then if we have time for questions at the end, we'll take some questions. Otherwise, like we said, if you want to write down questions, we'll keep this topic going for the future. All right. So anyway, we have Sherry Preby from Three Links Care Center. Sherry is the Chief Operating and Human Resources Officer, and as many of you know, Three Links is undergoing transition with ownership and leadership, so Sherry's going to talk to us about that. Paula Plank, who was my dear colleague at the Long-Term Care Center for many years and also worked at Three Links, and will be taking a new position as the Director of Nursing at Farmington Health Services, which is important to all of us because Farmington has taken a number of the residents from long-term care who were displaced by the closure. And then Mary Carlson, also my dear friend and colleague, who is a geriatric nurse practitioner and sees patients at Three Links Care Center right now, but has been basically in all the care facilities over the years here in Northfield. So Mary brings the perspective of medical provider, which is, I think, really helpful too. And then we have 2 our leaders from Northfield Retirement Center, Jen Murphy-Warnke, who is the Director of Health Services for all of the assisted living care at Northfield Retirement Center, which is growing quite quickly. And then Mallory Dingman, who's Vice President of Housing. So anyway, we have a good group representative of our main care facilities. So I think what we'll do, Clark, maybe if you want to give them the microphone, and then you guys can kind of pass it down, and I don't know. Okay, Paul, you're first, I guess. So the first question is, how would you summarize the status of elder care in Northfield today? Kind of what's going on, and how has it led to changes in your healthcare setting?
Okay. Well, first of all, welcome everybody. Thank you so much for attending this quorum forum, I'm sorry. And I just wanted to say it's impressive to see such a large group that's interested and concerned about senior care in Northfield and throughout the country. The first question is how the status of elder care has changed. For me, I was the director of nursing at the Northfield Hospital Long-Term Care, and we just closed our facility October 5th. So it's affected me very greatly, personally and professionally. Our closure was a result of financial concerns within the hospital and also in long-term care. We were a facility of 40 residents, a great little household we had with wonderful staff, and we provided exceptional care, but financially we just couldn't make it with the reimbursement and staffing. COVID hit us very hard. COVID affected our residents and our staffing, so we had to limit the amount of census to meet the staffing needs. And financially, we saw staff leaving, not only long-term care, but healthcare. During COVID, we saw a large majority of staff leave. So that hit us financially by having to hire new staff, offer bonuses and things like that. So we just couldn't keep up with the reimbursement, and our facility did close. And we had to find new care centers, new homes for all of our residents, and all of our staff had to find new jobs. So I am very proud and happy to share that I accepted the Director of Nursing position at Farmington Health Services.
Awesome. Thank you, Paula. And then we thought maybe we'd go down to NRC because there's some changes happening there as well. So they're going to share about what's going on at NRC.
Yes, thank you, and good morning, everybody. Thank you so much for having us here with you today. As we mentioned, so the Northfield retirement community has also been going through a time of transition. We certainly have coined this year as our transitioning year. What started our transition, we had a 22-unit assisted living section of our campus, Cannon Valley Suites, which some of you may recognize the name of. Earlier this year, we started to make transitions due to the changing of needs, finding a greater need for memory care on our campus. And so part of our changes started there in making Cannon Valley Suites a more secured, dementia care specific unit. I think we felt like we were already providing similar level of care there, but to be able to make that unit more of a formal secured memory care space certainly helped us meet the need of our changing campus in that direction. Later, that led to us also having to really carefully review the changes within our skilled nursing area. As we know of today, the Northfield Care Center. This is a 22-bed skilled nursing area that we had typically around 12 to at most maybe 15 census, really for quite some time. And so, of course, COVID had a great impact of that for us. As we took some careful review in terms of staffing, having to meet some pretty rigorous staffing ratios for a small area of around 10 or 12 residents, really financially was not making the most sense. And so we also took quite a bit of time reviewing and considering what is our mission, how do we continue to best serve our residents on our campus. And so on September 25th, we made the announcement of the closure with the transition of, closing the 20 beds of skilled nursing, removing that licensure from those beds. However, with that, we are transitioning into an enhanced care assisted living model. So in order to do that, certainly we were very grateful that our census of 12 residents at the time, all but 2 are able to transition in our enhanced care and continue to be served in the same way they were. So that for us was really a good success in that, our staff being able to stay on board with us and for us to continue to grow and serve residents in a little bit less restrictive environment.
Mallory, maybe you could comment on, or Jen too, like the difference between skilled nursing and enhanced assisted living. So that's the change that's happening there. Is all the skilled nursing beds are closing, but you guys are adding enhanced assisted living. What's the difference?
Okay, so with a skilled nursing facility, the requirements are a lot more as far as like with staffing. You have to have an RN now 24/7. It's very hard to staff an RN 24/7, let alone have a nurse there. So with our enhanced unit, we don't have to have a nurse 24/7, but we are going to have, we're lucky to be able to do this, we will have actually a nurse from 7 in the morning until about 11 p.m. at night. So that is why we're able to do an enhanced unit. We'll be able to do those that require insulin, maybe some higher level of wound care, just some other things that maybe you could only get in a skilled nursing facility, but with our enhanced, you'll also be able to get some of those things. So there just wouldn't be a nurse still overnight, but we do have on-call all the time, so that wouldn't be an issue if we have to come in too. But as far as other differences, I don't think there's, what else would you think?
One of my other questions, because I think one thing that lands people in skilled nursing is just mobility, like needing help transferring from a wheelchair to.
Yeah, we'd still be able to provide all those, the type of mobility you would get in a skilled nursing facility in the enhanced unit. All the lifts and the stands and all that. And we will still have therapy. So therapy would still be the same. We'd still be able to provide that. They actually, they provide care to all of our residents who need it on campus right now. So that would not change. What else?
Yeah, great. Okay, thanks. All right, and then Sherry, it's your turn. You're holding down the fort in Northfield with skilled nursing at 3 Links. So let's kind of hear how it's been for you guys.
Yeah, so 3 Links, we definitely are going through change, kind of similar to what Paula talked about, kind of through COVID and financially and staffing. So we had to take a look at kind of like, what do we do with the business? How do we keep moving forward? With the Great Resignation, we had a lot of leadership that decided they wanted to move on in healthcare. So that became a struggle where, you know, my boss and I both take on double roles, and it's very challenging to do that. So we had started a process of deciding, you know, do we look for a partner for the future? And through that process, we did find a partner called St. Francis, which we will be merging with on November 1st. It'll be very exciting. We will be the only long-term care in Northfield to provide service, and we're super excited about that and excited to work with these folks here. Because we want to partner and be able to offer the long-term care services to the community of Northfield. We also will continue with our continuum of care through our assisted livings. We have, you know, Millstream Commons, the cottages, which is on the 3 Links campus, and then the villages of Lonsdale. So we'll continue to offer the continuum care, but through the merger, we'll end up having more resources and be able to help Northfield more effectively and partnership with the other assisted livings in town. So we are very, very excited about that. And Paul and I actually will become sister facilities. So the facility she's going to is also a St. Francis facility. So our communities will be able to work together with the other partnerships around Northfield to make sure that we can make sure that everybody has a good place to go.
Okay, awesome. Can you tell us a little bit more, Sherry, about St. Francis and this is if you don't know, that's okay. But the organization, how many facilities they own and things like that.
Yeah, so St. Francis has been around for a very long time. They are 13 nursing home facilities around Minnesota. We kind of have a region that will be part of, so it'll be Northfield, Zumbrota, and also Farmington. So it'll be kind of nice. We'll have other people to work with and have good resources with. Most of their home office is out of Morris, so a lot of their corporate team, they will end up traveling around and helping us in different areas, each of the facilities. And they are kind of backed by kind of a Catholic backing. So it's very exciting. They're a great organization, and it seems that they just kind of keep growing and growing.
Awesome. Yeah, that seems like a really positive, collaboration. So I think that's
They're just
good.
a perfect match for us. When we were looking for a partner, we were thinking about our mission, vision, values, what it means to us and how we care for people and employees, and they just met the match on everything that we were looking for in a partner. So we know that it's going to be great. Of course, when people merge, you have different policies, procedures, and things and how you do it. So we'll just be going through the transition stages of, kind of collaborating and mixing our little styles together. So that'll be exciting and fun.
Okay, awesome. Thank you. And then, Mary, you're kind of the person who's been at all places and has been here for years. I mean, you've kind of been through the whole COVID with long-term care, and I mean, just that, going back to the question, what do you see as the status of elder care in Northfield and being everywhere?
Thank you. It's great to be here and look out and see family and friends. And I think what all of us have in this room, or many of us, is a historical perspective. And we remember what elder care was like, say, 30 years ago and how it's evolved. And you can correct me if I'm wrong, but I think about 30 years ago in Northfield, all care, people who needed care were all in skilled nursing facilities, and we had 3. And then gradually we started to see these assisted living facilities pop up. And when I started providing care 30 years ago, I would only go into these nursing homes, and we would take care of people who had just gotten out of the hospital or people who were there for long-term care and, of course, end-of-life care. And then, I don't know, a dozen years ago, friends and family started saying, hey, my mom is over at Parkview on the Northfield Retirement Center campus. Couldn't you just run over and see her? And so at that time, I worked for Alina Northfield, and they said, sure. And then the way medical care is delivered to frail elders evolved so that the norm became having teams of people who only did geriatric care instead of working at the family practice clinic and running out over the noon hour or on weekends to kind of do this additional care. It became our full-time work. And so currently I work with Dr. Steve Lawler, Dr. Sandy Turbis, and Marianne Loftus, nurse practitioner. And all of us live in Northfield and really care about this community. And so we, as a team of people, are able to go into, well, now just the one skilled nursing facility. So 3 Links is the only place in town, in general, that if you have a hospital stay here in Northfield or up in the cities or Rochester, and you need a little rehabilitation, now going forward, 3 Links is the only place that offers that short-term rehab service. So we provide care at that time, as well as the skilled care. And some of the things that skilled care does is people who might have a feeding tube or need IV antibiotics for 6 weeks, or have very difficult to control diabetes, some complex medical situations, so requiring more skilled nursing 24 hours a day. And then we also go into the assisted living facilities, again, as a team, here on the Northfield Retirement Center campus, next door, and the 3 Links campuses that Sherry mentioned. And there's and the medical group is called Genevieve, by the way, and it's owned by Alina, Presbyterian Homes, and Cassia, which are nursing home organizations in the metro. And so we provide care in many places.
Yeah, and we should mention Benedictine Home too.
Oh, and Benedictine, thank you. Yes, we are providing
Genevieve,
care there.
also assisted living at Benedictine Home, and
Right.
Genevieve provides services there with Marianne Loftus as well.
Correct,
So,
thank you. Yeah, and Benedictine has independent living, assisted living, and memory care assisted living. And we serve people who are frail, and it's difficult to go out and maintain their relationship with Dr. Rensheimer. It's always a sad day when people, because you have this long-term relationship, and sometimes it just makes more sense to have your care in your home instead of going out to the clinic.
Right. Yeah.
Thank
That is
you.
a hard time, yeah. So, okay, well, thanks. So then the next question is, what do you see as one or two of the main issues or challenges affecting long-term care today? And a couple of those things you guys have alluded to, and maybe you could elaborate on the nursing, staffing, just staffing in general, just the reimbursement. I mean, and you guys can kind of pass it on. Whoever wants to speak, just grab the mic, I guess.
I have the mic. I'll say something really quick. Will we have enough capacity in Northfield for people who need this skilled nursing care or transitional care? That's my question.
Looking at my notes here, as you can tell, I'm not a great speaker in front of people. So definitely staffing, coverage, fewer working population to take care of this elderly at this point. We have, they're saying as our generation, like the population of elder is growing, but yet we don't have enough of the staff to take care of the population. And I'm not sure what the answer is for that or why that is, but encourage people to go to school for the medical, nursing. That would be great. What else did I have on there? Oh yes, reimbursement rates. That's kind of one of the big ones as why the skilled nursing facilities have a hard time. The reimbursement rates, the regulations, the federal requirements. It's hard on skilled nursing to be able to take care of everyone and not be able to afford it. They just don't have the money. That's all I have.
Yeah, I think to your point, Jen, I mean, one of the things that surprised me in working at long-term care is just the amount of, regulations that we had to follow, surveys that we had to do, all the paperwork. I mean, there were at least one or two nurses, RNs, that basically worked on compliance, meeting compliance, and then every year surveyors come and check everything out. And so there's a lot of burden for that alone, which requires a lot of time on the hands of the staff, I would say. So, yeah. Okay, anybody else?
I think we all agree staffing is our number one issue in senior care all around. We do not have enough people to care for all of our seniors and their needs. And hopefully, getting people interested in healthcare and nursing and offering competitive wages, maybe we can draw people back in. I lost some of my registered nurses to two of them became bartenders. Nursing assistants can get paid more at Taco Bell or Target. So we have to be able to offer a competitive wage that draws people in, because senior care is so difficult. It's just physically draining, it's cognitively draining, emotionally draining, and a lot of people, it's just so hard that they choose to work elsewhere. And we really need to get them back in to help care for our seniors. It's so very important. And I too, along with Mary, I've been in long-term care myself almost 40 years. And so I accepted a job at 3 Links back in 1985 as a nursing assistant, and it was a really good paying job at $3.15 an hour. And I was so proud to work there. And it really drew me in because I love seniors. And we need to have the younger generation love seniors if this is going to continue to work. So I think staffing is huge. Reimbursement is also so senior care anywhere, long-term care, assisted, it's expensive. It is very expensive every month, but it still doesn't meet the financial needs of the facility because we have to pay the staff, we have to pay the benefits, we have to pay for the electric bill, the heating bill. All of those bills are going up and up and up, and the rates are set by the state of Minnesota. And Minnesota is only one of 2 states that has rate equalization. So in the whole United States, there's only 2 states that we can't charge private pay more than we do medical assistance. So it's a set rate. And it just doesn't, we can't raise the rates unless the state says we can raise the rates. So rates are set. So as our bills and our expenses go up, our rates do not. And it doesn't equal out. So I think those are 2 of the, well, and the third thing, because I can think of one more, and Mary just touched on it, is as senior care changes, and now we only have, we have less and less ability to provide skilled nursing. We have limited beds. And as those fill up, I am concerned about who's going to care for the seniors in the future. I think that's a real concern.
I'll just touch a little bit more on staffing. So we just kind of went through a process too of how do we get more people into the workforce or be interested in. So we did just look at our wages. And so we are doing an increase to the wages to hopefully tempt people to become interested in healthcare and to work. And I think a big piece of it is once you get the employees there is the retention piece. So of leadership and all the employees, it's how do you retain people to keep working in a business that is, kind of like Paula said, it can be very draining for people to take care of other people, but also all the ones that work in it, like it's so rewarding, and it feels to me, for me to be in senior care, it's like a blessing. And, I feel like God has come and said, I want you to, do this work. So that's why I do the work I do. But I do care about the employees and, making sure too, another piece is making sure we're continually be able to offer them training. That's another piece. If, we were offered different grants or things to help people become more interested in learning to be like a nursing assistant. So I think there's just a lot of more things that we have to work on with, Minnesota Department of Health and other organizations that can help us keep caring for seniors and be able to keep people interested in helping. And I do think too, after we've gone out of COVID, prior to, I used to back in the day bring my children in with me to work on like the weekends. We'd go help serve lunch or we'd help with bingo. And so one of my daughters has been in healthcare and she absolutely loves it. I never thought I would see her doing the things she does and helping elderly, but she absolutely loves the elderly. She will always be in healthcare. And I have a son who's 8, and he keeps asking, when can I come in and read a story to someone or play bingo? So I think the key piece too is getting the schools involved, getting the 4-H clubs, Boy Scouts, Girl Scouts, whatever those may be, to come in and work with the seniors, and just even for them to come in and have a conversation with them. Because I'll tell you, 8-year-olds can have really neat conversations. Like coming here today, I was a little nervous, and my son says, "Mommy, believe in yourself." And I thought, wow, that's pretty cool. So I think there's a lot to do on the staffing end, and just, reward the staff that actually are working in the healthcare, because it's so needed, and we need these people that want to care for others.
Okay, awesome. That's great, Sherry, because that kind of leads into the next question, which is like, what are some future changes that you guys think are coming, or ideas you have? I think that intergenerational piece is really important. Trying to involve younger people and recruit younger people and keep them in healthcare. I mean, I don't know if there's other ideas about what you see coming down the pike. As far as, the enhanced assisted living seems like a trend. I don't know.
I think what we're seeing is happening right now is the future of long-term care. What we're seeing is skilled beds are getting less and less as assisted and enhanced are growing to meet the needs of the seniors. And I think we're going to see, well, we've already seen the smaller facilities cannot survive. With Northfield Hospital long-term care closed, Kenyon's closed, Cannon Falls is closed. Faribault used to have 3 skilled nursing, now they have 1. Northfield used to have 3, now we have 1. I think this is the future, is that we're gonna see less and less skilled and more assisted, and maybe even more group home type, smaller, like the Elysian Homes behind Target. I think we're gonna see smaller homes, things like that. And we're gonna continue to see a lot of regulations and not well reimbursed. I think that's gonna continue. Yeah.
One of the things my organization does with people who are living in the community who are on medical assistance is they have registered nurses who are involved as case managers. So sometimes people enter the healthcare system because they weren't able to get their medications filled, or it was a social problem, not a medical problem. So using nurses to manage care so that people don't end up in the hospital, they don't need long-term care, trying to optimize health. So I think that idea is here to stay and is a positive. There's also a movement called Hospital at Home, where more care will be delivered in your home. I don't know about that happening right here in Rice County right now, but that's happening in other places.
I can just think of one thing I wanted to say about that is people are outliving their funds, and so then, you know, how do they survive or live where, you know, a lot of facilities don't take elderly waiver, so then you run out of your money and then you have to look to go somewhere else, and where is that? We can only take so many people with elderly waiver. You don't get reimbursed a lot for elderly waiver, but people are outliving their money. So what do we do with that? Some facilities like us, when you do run out, we keep you. So don't worry about that. We won't kick you out. But there's a lot of facilities that don't take elderly waivers. So that's one thing you have to look at when you're starting to look for a facility to go to.
And to just kind of piggyback on that point exactly, I think when we were evaluating what are the trends that we're seeing now and what trends do we think we'll see going forward, one of the things I think we were seeing a lot of now was fewer and fewer 3-day qualified stays coming out of the hospital, which then, of course, limits the availability of using Medicare covered benefits and insurances. And so when we really looked at that and at least noticed that trend at our campus, that also helped us think about ways that how we're going to have to really come up with some good solutions for providing affordable care going forward. And so with that, our changes and things we've made and are in the middle of making at this time, that has certainly been a focus point for us. And to Jen's point about the medical assistance programs and home and community-based services, I think we'll certainly see more of that. And as Mary mentioned, even in a person's home. So before they come and need to have a 24-hour care situation, likely they may already be tapping into some of those other services, but then to be able to continue and to do that in our settings and have that financial help certainly is part of this too.
Okay. About the 3-day stay, or. Oh yeah, for sure. Okay, all right. So we're getting to the end of our time. So our last question was, what advice would you give to someone who's starting to look for senior living or long-term care options in Northfield? And maybe before you guys answer, I'll say, so at the end then, if you have questions, because we're probably not going to have a lot of time for questions, if you want to write them down for us on the yellow pieces of paper, we'll try to bring another group together here and talk about those. Also, if you guys want to stay in the back in the narthex afterwards and you have specific questions, if that's okay, if you have time, that would be great. So All right, what do we do? What advice?
The thing I would say is start looking early. Don't wait for a crisis to happen. Start looking now even and get your name in, application in. They may call you and you can say, I'm not ready yet, and then at least your name is in there. And consider things like, do you have family around that area? Do you have, do they have transportation needs? Do they have spiritual care? What things are you looking for at a facility?
Two very concrete pieces of advice. One, there's a person named Jolene Nelson at Rice County Public Health who understands all the ins and outs of the financials of needing some kind of assistance for long-term care. And Jolene Nelson at Rice County Public Health has helped so many people as a social worker. And then there's another saint in town, or in Rice County, Nancy Top, and she has a group of adults who provide companion care to other adults. So sometimes they're not nurses, but sometimes if you're caring for another person at home, you just need someone to come and be with them for a few hours while you go do the errands or something. So Nancy and her coworkers provide a wonderful service.
Thank you. I can think of two things. Start now, start early. Volunteer, come visit our beautiful facilities that we have here in Northfield, get to know the staff, make some new friends with residents. Many of our residents have outlived their families and friends, and they're lonely, and they would love to have visitors come volunteer at bingo. That's always a fun thing to do. But getting out, coming to see what each facility offers, and plan ahead. We often plan for our deaths. We prepay our funerals. We plan to what happens when we die. But what about the last 5-10 years of your life? Where do you want to be? Where do you want to live? What help will you possibly need? Start thinking about that now. And like Jen said, don't wait for a crisis. Just know what your plans are ahead of time and get to know the facilities.
Just to kind of wrap that question up, I agree with everything that they had said. I guess the only thing I'd like to add is 3 links on our website. Monthly, our sales and marketing person has different people come in. We had senior linkage there the other day. We've had information about Medicare, how does it work. So we offer free classes. Usually she does it during lunch, so you can have a free lunch. So I watch the website because some of the things they've mentioned, we do free training sessions on that so you know what to do for the future. So we welcome you in.
Okay, that's awesome. And just to clarify one thing, Jen, you guys say get on the list. So basically that means fill in an application, get on a waiting list for a facility, right? And then if your name comes up and you're not ready, you just keep getting moved down the list. They'll keep asking you, right? So there's no harm in planning ahead and starting that early. So that's kind of a good tip. People sometimes think, well, if it's too soon, do I get kicked off the list? But that's not the case, so it never hurts to plan ahead. Oh my gosh, okay. We have time to take one question. Does somebody have a question? Yeah, Alan, you had a question? Let me run this over here to you.
A lot of what I've heard from every one of you was emotionally draining and paperwork. Is there any sort of volunteerism in that respect that anyone can do?
So Alan asked, one of the things that's taxing is just the emotionally draining work of caring for elders and also just the paperwork. And he's wondering, like specifically volunteers, is there a way volunteers could fill in to help those things?
Yeah, I think at each facility they welcome volunteers, and connecting with the life enrichment director at each facility for looking for ways, how can you help? Sometimes we just need help pushing wheelchairs to church services, or volunteering at bingo to sit next to somebody to help fill out their cards. There's so many limitless non-skilled kind of volunteer things that we would love help with.
That's great. All right, well, a huge thank you to our panel. They've come on Sunday morning, and all of you guys. So,
Just a thought. If there are students in your family who are looking for volunteer positions for their National Honor Society, it's a wonderful place. We have a grandson and granddaughters who have worked at Three Links and other places. The activities coordinators are always looking for volunteers. I had the joy of working with your daughter in activities for about 2 years, and she was just a joy to work with. She just walked down those hallways, and every resident was looking for her to stop by for a few minutes. And it's just amazing what joy and experiences a lot of those young people get from visiting with seniors, telling their stories, their life stories. Everybody likes to tell about their own life. And so it's a wonderful place to get volunteer hours in, and I would really encourage checking with any of the facilities in that way to get their hours in for National Honor Society, for example. I just want to say thank you to each and every one of you for coming forth and being willing to come and spend this time with us. We really believe this is a huge topic, and we knew we couldn't cover all the groundwork, but you've given us much to think about today, and looking for people to enter the medical field, for example, whether it's as a nurse assistant or whatever. I know that that need is constant. So thank you very much for being with us. I think, again, a round of applause for these wonderful people who have helped us. And if you do have questions, write them down, give them to Jane or myself. Thanks, Jane, for moderating this time. That was super fun to work with Jane. And Gary Meisler is on the board at Three Links, and he had a family event this weekend, so he was not here. So again, thank you for coming.